TLC actually stands for the original owner's name, Tammy Lynn Crosby, but it also embodies what TLC is for the community. It is and has always been a place where people come for not just prescriptions, but for all of healthcare advice and support.
Working as a team at TLC, honestly, is probably the best work environment I've been in.
The team is really positive. Everybody's always cheery and upbeat.
I've never worked with people that get along as well as we do.
Colleen herself is very caring, so I think caring is contagious. It sort of spreads through the whole team.
The management at TLC Pharmasave really subscribes to taking care of their team first, and in fact encouraging each other to take care of each other. Over the years, they've had a really great balance of courage and thoughtfulness to evolve their practice. Everything from modernizing their physical plant, their technology, their knowledge, their community outreach to create patient care opportunities.
The pilot project has filled so many healthcare gaps that we didn't even know were there for our community.
It seems like there's different programs that are always coming here, like with the primary care clinic and things, and it's encouraging to see that innovation and creativity and openness to offer services.
About a third of our patient population a few months back were without a family doctor in our county.
We lost our doctor in December, so I've used their clinic. I've used their delivery service. We do all our vaccines here.
In an area like this where there's limited access to family doctors, people really value the relationship with the pharmacist and what they can do for them.
I know that if I call that I get someone that's lovely to talk to, which is important. And not only that they take the time to even review patients' history and they'll go through that stuff. So they are reliable.
We felt very lucky and honored to be one of the first sites to offer COVID clinics.
Everybody truly cares about the people in the community. A good example that's very recent is during the wildfires.
We had a number of people who were displaced from their community and had moved to ours, who we were trying to help as best we could for their medical needs.
Colleen and I were in the store opening and realized that we really only had probably 3 people available to work. So on our internal staff page, we put out an SOS, and within a couple hours, we had 14 people here. The store's packed with employees. People drove from Bridgewater, Liverpool, everywhere that they had evacuated to. Employees came back.
We just muddled through and we helped people as much as we could.
I was able to come back here and work. There were a lot of people coming in, who were evacuated, and it was good to just talk to those people, give them a little bit of comfort, make sure that they're doing okay.
Even during that, you try to stay positive and try and just help the patients as best you can.
You would have been shocked to have been into our pharmacy during that time, during the fires. You don't realize the supplies that go into keeping boots on the ground, literally. It was like supermarket sweep. My husband didn't bat an eye. He just said, take everything that they need up to the fire hall. And that's what we did.
We have a new pharmacist who's just been here a year, and she was actually on her first vacation when the fires broke out. But she'd stayed with her family in Halifax because they had also been evacuated. And we told her to just stay there, not to worry. But she drove down to help us because she said it's her community as well.
Every one of our staff members showed up, which we didn't ask them to. We told them, if you need to stay home, you stay home. If you need to be with your family, be with your family. If you need to go out of town, you go. But they all showed up with their cars packed up, ready to leave, with their kids in the next community over, not knowing what they were gonna come home to. I couldn't believe that they showed up like that. And I'll be forever grateful for it. And I know the rest of the community was too. People would come in and say, why are you here? It's like, where would we be? Where else would we be?